Good evening, everyone. I'm called Dr. Kenneth Kalani. I'm a psychiatrist, and I also coordinate mental health services at the Ministry of Health. I'm here to represent the Director General. He was supposed to be making this keynote speech, but he got an emergency, so he called upon me to represent him. So I'm happy to be here. Thanks for inviting us. And I'm very happy that we are having a lot of focus on mental health. I'm also very happy that people are beginning to open up and looking at mental health as a priority that it should be. And I'm even very happy that students, young people like you who are about to finish and go on to the world are preparing, because as we shall see later, it's usually a different world the other side. We all face different kinds of challenges, and we need to be mentally healthy. So I recognize everyone. I greet you all in your own capacities, all protocol observed. I want to thank the previous speaker, my colleague. She's made my work easy, so I will skip some section of what I was supposed to present. So someone asked about the mental health services, the fact that services are expensive and are not affordable or reachable. That was part of my presentation, but I'll answer it nonetheless. So by the time I reach that section, I will just refer to the answer that I'm giving him. In Uganda, we have both private and government services, just as any other healthcare system or any other healthcare is. Mental health is supposed to be integrated into primary healthcare. That means that if you walk to a health center or district hospital, someone is supposed to support you. Okay? We start to specialize at the level of a district hospital, where the district hospitals have what we call the psychiatric clinic officers. So psychiatric clinic officers offer support. They can diagnose and provide treatment for persons with mental ill health, and they have psychiatric nurses as well. We have about 13 regional referral hospitals. So every region has a regional referral hospital. And all those regional referral hospitals have mental health units, which is a fully fledged independent unit to treat people with mental illnesses. Then we have the National Referral Hospital, which is Butabika Hospital, which provides super specialized services like alcohol and drug use or addiction. It also provides services for child and adolescent mental health. It also provides forensic services and so on and so forth. So that's the line of care that exists. We also have a lot of partners that we work with as a ministry, and they support us, like Strong Minds. I'm happy that they are supporting this. They are a very big partner that we work with. We have TPO, and they have a range of services that are geared towards providing basic support services, self-care, and providing talk therapy, psychotherapy, you would call it, to persons with anxiety and depression. So all these things are there. We just want to make this information more known, and then people can have access. We've noted that a lot of we have hindrances or barriers to seeking care, and one of the biggest barrier is stigma, because people equate Butabika Hospital with mental illness. So if I want to see a psychiatrist, I'm mentally ill, and so on and so forth. But that's not what it is. So I hope I answered your question, and as we go on with the presentation, I will continue to answer more of the questions. So next slide. Next, that's how we are going to progress. Yes, so my colleague defined mental health, but what I just want to add is that everyone has mental health. You know the saying, people usually misquote this saying. They say, we are all mentally ill, but it's the degree that varies. Isn't it? It is supposed to be the other way around. We are all mentally healthy. It is the degree of mental health that varies. So all of us have mental health. As people who have listened to me, do not say that I have mental health to mean mental illness. Okay? Because we are all mentally healthy. As you see the definition, that is a state of well-being in which you realize your abilities to do what you should do. You can cope with normal stresses of life, can work productively and fruitfully, and you're able to make a contribution to your society. It's very simple that they are the day-to-day things that we require. So that means we need to be mentally healthy, to work productively, to make meaningful relationships, to make connections with others, and so on and so forth. So it is something that we all have. Next slide. This is the next slide. Okay. So I bring in the concept of mental illness such that we get the definitions properly and clear. Mental illness are conditions affecting the brain that interrupt the way we feel, the way we think, the way we communicate, and the way we behave. Okay? So people with mental illnesses, their way of feeling and thinking and communicating and behavior is altered because of the mental illness. I put that in bold, conditions affecting the brain, to emphasize the fact that mental illness is a disease. Okay? Just like we have illnesses of the liver, just as you have illness of the heart, mental illness is illness affecting the brain, and it can be treated. Okay? But because it affects the brain, it is going to affect the way we feel, the way we think, the way we communicate, and the way we behave. And this is what we see out of people. Okay? So it usually causes disturbance in social or relationships. So people may have these problems in creating social relationships. They may also be distressed. So people with mental illness are under a lot of distress. Okay? They suffer a lot of psychological pain that they need to be supported. Okay? Because you can't imagine you are seated there. Okay? And then you start to hear a voice of someone talking to you and abusing you and telling you you're worthless, telling you you cannot make it in life. Or you hear two voices of people discussing you. Look at him, now he's seated, he's planning to do this, he's going here, he's planning to eat, he's planning to go to the toilet. These things make running commentary. You imagine the stress these people go through. So mental illness causes a lot of stress to the people or the sufferers. Because someone who is depressed feels sad all the time. They feel worthless and they feel helpless. And sometimes they even don't know the reason why they feel that way. Because sometimes it may happen in the context where there is no clear reason. And so they feel a lot of distress. Mental illness is common. It affects 1 in 5 people. Okay? It is that common. So if I pass the form here to try and screen all of us here, we may find some people have mental illnesses. Sometimes even undiagnosed. Okay? Mental illnesses, the burden of mental illness extends beyond the individual to the family and the communities. If all of us, and I can ask all of you here, if you have a relative or you know someone who has ever had a mental illness, all our hands will go up. That tells you how common mental illness is. Okay? But also if you've ever taken care of someone with a mental illness, you know that the burden is not for the patient alone. It It is for the family. Someone who was responsible and then they undress. Someone who used to work, he refuses to work, sits home. Who is going to take care of the children? Their work that we're going to do, who is going to do that? So at the end of the day, the entire country is affected because of the burden of mental illness. So it is our problem. It's a community problem. You can't be left alone if you have a mental illness. Mental illnesses can be treated, yet 80% of patients don't get the treatment they need. That treatment gap is so big. The majority of people we see in Butavika, for example, that's 1% of people. The majority of people who are ill are where? The community and homes are people like you and I. We walk around every day. But we have the mental illness. Okay? So that is how common it is. So there are types of mental disorders, and the common types is depression that she talks about. Depression is a mood disorder that presents with persistent and excessive feelings of sadness, worthlessness, helplessness, and loss of interest in the things that used to make you happy. And people with depression often have suicidal tendencies, or they look at death as an alternative to end their suffering and the way they feel. Okay? Anxiety is also common. Anxiety is a form of mental illness that comes with excessive fear and worry about problems of everyday life. Okay? Trauma and stress-related disorders like post-traumatic stress disorder is also common. Then alcohol and substance use problems. This is common. Recently, I'm told as Uganda, we rank, we are the best in Africa in alcohol consumption. Those are not good statistics. Okay? And that has a bearing because alcohol use and substance use disorders are interlinked with depression and anxiety. Some people take alcohol and substances as a way of self-medicating their pain, the way they feel. Okay? Whereas some people, because of the alcohol use problems, they will develop the other problems as well. So it is a big problem that we should address. Epilepsy is not a mental illness per se, it's a neurological problem, but we put it there because it's our mandate as a ministry and it's quite common as well. Other disorders, autism spectrum disorders, are disorders in children where children just do not know how to make social interactions. They don't know how to make friends. They will play alone. The mother comes, they will not be happy. They will not interact. Attention deficit and hyperactivity disorder is a kind of disease where children are restless. They are inattentive. They cannot pay attention at anything. They are very hyperactive, be jumping all over the place, and it's difficult for them to maintain focus on anything. Then we have schizophrenia, which is a severe form of illness where people hear voices of people they don't see, or they see things that other people don't see, or they believe things that are not true about them. That is schizophrenia. So people with schizophrenia are the ones, maybe sometimes you'll see them walking on the streets and they are carrying rubbish. They have that disease called schizophrenia. Bipolar is a disease of mood where there are highs and lows. Someone says that sometimes people with bipolar are extremely happy, can have a phase in their time when they're extremely happy and excited. And then another phase where they are really down. So it goes up between the two extremes of mood. That's why it's called bi, to mean two, and the two poles to mean the extremes of poles. Eating disorders, personality disorders, there are very many mental illnesses, but these are just the examples that I wanted to show us. Next. Next slide. So I want to talk about stress briefly, and then I later link stress because this is what relates to us. She hinted about it, but I want to define stress as, so you are an individual. Got the next slide? You are an individual, and maybe this is you. You have very many demands upon you. So you have school, you have a to-do list, you have relationships. Sometimes you have children, you have a job, you have deadlines, you have family, In Africa, we have extended family. You have demands from extended family. You have school fees. And this is an individual. You're supposed to meet all those demands. Sometimes we don't have the resources to meet those demands upon us. We may not have the financial resources, may not have the emotional resources, may not even have the physical resources in terms of energy. Once there is that mismatch, we say we are stressed. Okay? And stress is common because everyday challenges face us with stress. Next slide. So she talked about this, that behind we see poor sleep and all this. There are very many problems that people go through, and I think I will have time later to talk about this. Next slide. Yes, so stress affects our mental health, or the continuum. So every time you're stressed, you tend to, you move towards poor mental health. Okay? You're supposed to employ strategies she talked about, the self-care, in order to go back to perfect or good mental health. In case you don't employ those strategies, or in case the stress is too much, you will go towards poor mental health. And if you stay there for long, you'll start to develop emotional problems. And if you stay there for long, you'll find yourself with a mental illness. Okay? So it's important that we know that illness, you do not wake up one morning and you're mentally ill. No. It is a continuum, as they say. I start here, I keep going, I keep going, I keep going, to the point that I reach here. People who get ill, people who commit suicide, people who get depressed, when they die, is when we start to say, we noted some changes in him. He had changed. He was staying alone. He was not talking to people. He stopped coming to work. He became quiet. He neglected himself. He wouldn't comb his hair anymore. He wouldn't even iron his shirt. He wouldn't laugh anymore. He wouldn't chat with anyone. Those are changes that happen. And at the end of the day, if nothing is done, you find yourself at the end of the spectrum with a mental illness. So these are the warning signs, and I've gone through all of them. Changes in eating, dropping weight, dropping in grades. You learners or teachers here, you notice your student has been an A-class student, and all of a sudden you start to not drop in grades. You should start to question. Because mental health or mental illnesses or mental health problems affect performance. Sleep problems, and this is something that relates to all of us. Changes in appetite. Sometimes people can stress eat and you find they're overeating. But commonly, they lose appetite, and that will have a reflection on their weight. You notice that they are becoming smaller. So you should ask, they just refuse to eat. Lack of self-care. They used to be neat, they clean their hair, but you notice that there are changes. Those are warning signs. Some people indulge in self-harm. I don't know if you've seen that. Cut yourselves. Cut your wrists here. Okay? So that is a negative way of dealing with stress, and we call that a negative coping strategies. So some people, they will want to transfer that emotional pain that I talked about, and they want to transfer it into physical pain. And they say, sometimes when I cut myself, I feel better, or the pain that I have in my brain goes down. And we've seen people engaging in self-harm. So all those are telltale signs that they are mental illnesses. And of course, once we see this, we look out for the other common stressors. We see the other side. Relationship, someone talked about relationship here. Someone who has broken up, maybe they are not coping well with a breakup that has just happened. Sometimes bullying occurs. There's even cyberbullying that occurs in our contexts here. School or sports failure. Maybe they were high performers and they declined or failed. Then they start to feel that because of that, it stresses them so much. And they start to get these symptoms. They may have concerns about their sexuality. They may have risky behaviors such as alcohol, and sexual behaviors as well. Sometimes that can also be as a negative coping strategy that we can look out for. Then we look at for family risk factors such as death, separation, divorce, because all these have impacts on us as children and even as adults in that regard. Next slide. So how common are mental health problems? I already said 1 in 5. Next. Bringing it to Uganda, heavy episodic drinking is up to 8.9% in university students, and this is an underestimate. Okay? Dr. Naluja did a study in adolescent girls in Mukono. Then he found that up to 16% of these high school girls had symptoms of severe depression. And they were not detected, not treated, nothing was being done. They even didn't know that they had depression. Okay? Anxiety disorders. Dr. Abo did a community survey in eastern Uganda. And he found that up to 26.6% of young people had anxiety disorders. That is huge. That is 1 in 4. Okay. These are published papers. Next slide. So this really tells us that the problem is with us and mental illnesses are real. And I couldn't focus so much on the others, but I just want us to pick the commonest one: anxiety, depression, alcohol, and substance use disorders. These are our biggest challenges in mental health. Go on. So this talks about COVID-19 and mental health. It would be, I would do you a disservice if I didn't talk about the effects of COVID-19 mental health. It disrupted services, but your mental health services, and yet the stress has also increased. And so we got many more cases of people facing mental health issues, many patients, and yet the services were also compromised in that regard. Next. So what are the drivers of mental health problems among young people in Uganda? Parental separation. This thing affects young people. You've grown up seeing your parents together and then all of a sudden they separate. Sometimes you fail to adjust. It's very, very stressful. You end up carrying the burden, and the parents are also not very helpful sometimes. You'll find one of them finds solace in you and then now starts to tell you their problem. So on top of dealing with the separation of your parents, you're also carrying maybe your mother's problems or your father's problems. And usually it's against hey, your father, hey, or your mother, hey, your father, hey. And that causes a lot of conflicts. It worsens the conflicts already. You should be a child, you should be enjoying university, reading your books, but you're having to carry burdens of your parents. Sometimes your brain is not mature or prepared to carry those burdens. And that impacts the mental well-being of a young person. Poverty. Poverty is common. And you cannot separate poverty and mental illnesses. The poorer you are, you get mentally ill, you heard that services are expensive, you will not get the services, you will go down again. The little you had because of mental illness, you will lose it. It's a downward trend. Is no recovery. So poverty is a very big factor. Peer pressure. Sometimes young people are under pressure. You look at others and you don't work within your means. I think she told us in self-care, draw realistic targets. Work within your means. Do not look at the other person and want to be like them. Because we are all different individuals. You are who you are because of the society that raised you, the genes you carry. So we are different. We grow up in different societies. We carry different genes. So I don't expect to behave like someone else, or I don't expect to achieve like someone else. Okay? So those peer pressures sometimes can affect us and stress people. Academic stress is very big. Sometimes we have unrealistic expectations, both for the teachers, for the parents, and even the learners. If your parent is not, we've just said that you are who you are because you carry genes of your parents. If your parents is not an engineer, why does he expect you to get an A all the time if you never got the A's in school? Okay. So we've reduced education to one aspect or development to one aspect. That is academic excellence. And that is just one aspect of development. We call that conceptual skills, getting conceptual skills. We are forgetting the social skills, we are forgetting practical skills that everyone can excel in and look at that as well. So there's a lot of pressure to perform, and sometimes unrealistic pressure that may not match the abilities of the individual. That causes them to stress. Someone can even start to feel that they are failures or they are not worth it because of the undue pressure that is put upon them. Relationship problems. You young people are beginning to make relationships here. And a boyfriend is cheating, girlfriend is cheating, separation, and all these things can stress you guys. Bullying, work stress, HIV is still common. The latest statistic, the prevalence of HIV in the country is 5.5%. But it's higher in certain places, even very high in urban settings like Kampala. So people with HIV are also prone to getting mental illnesses. Substance use has become a problem. People are normalizing use of cannabis, marijuana. Is that okay? That is not fine. People use alcohol. People use tobacco. People use cocaine. People use heroin. People use aviation fuel. People use all sorts of substances, and the young people are the targets. And you should protect your brain because young brains are growing brains. You know, the brain grows up to 21 years. That's why we are increasing the legal drinking age to 21. Even the legal tobacco use age to 21. Because the brain is still developing. If these substances gets into a developing brain, they can mess you up. And your brain will develop with a bend of a substance. It's very difficult to treat you as an adult. It's easier to deal with an adult who develops these things at the age of 30 or 40 than a young person. And unfortunately, the target is you. But most of people we treat started when they are still young. So it's important that you protect yourself and avoid these substances. You're going to go out there, get jobs, find peer pressure, get a lot of money, and you don't know what to do with these funds. Then you start to take alcohol and all these substances. Cannabis is in every form. It's in cookies. They even extract oil out of it. They drop in tea and people drink. These things are affecting your brains and can cause addiction and other problems that will be difficult to deal with. Next slide. So in Uganda, I just talked about this. I explained this family discord, sexual violence is common. This study here showed that 1 in every 3 girls is sexually violated. This is so bad. And sexual violence it has far-reaching effects, particularly for young people who are growing up. And this happens in workplaces. People normalize sexual violence and they see women as sexual objects. They don't respect them, even at workplaces. These things affect people. It affects women. I treat very many young people because of these challenges here. Sex for marks, sex for promotion, sex for this. Because it's your boss, he will demand for something. And if you say no, you're jeopardizing your work. And you know, because you don't want to jeopardize your work, you have responsibilities, you have people to take care of, you accept. But it's against your beliefs, so you'll be conflicted, you'll be stressed. Before you know it, you're sick. Because it's against what you believe in, you'll not disclose, you'll not talk to anyone, and you bear the burden alone. And that can cause illness. So that's a big problem. Be wary as you go out to work. Next presentation. High demands, I talked about all this. Next, move. Urbanization. I think I just wanted to mention one thing about the changing trends that we're experiencing, even as parents. Parents are finding it difficult to parent. Because in my time, maybe in the adults' time here, beating was normal. It was a form of disciplining. But can you beat the child of today? Not easily. They will interpret that differently. So parents are having challenges, but because of the economic stress, the parents are also not available. Because you have to work extra hours, you have to have more than 2 jobs. We are leaving our children with maids, we are leaving our children with caretakers, and and we are not passing on the values we want to pass on them. These young people, once they start to grow up, their brains are like blank flash disks. It is us who start to write. The parents start to write what they believe in. Nobody is born a Muslim or a religion, but because we are born in a society that is like that, we get that and it becomes part of our belief system. So if we do not transfer the good values that we have, as children, we are raising them up without values, and that is going to affect our country as an whole. So even you young people, you're going out, you're going to be parents very soon. Take care. Know that you need to be present for your children and pass the good values that you have to them. Because if you don't, someone else will. They will learn values from the screens. They will learn values from peers. They will learn values from anybody else. And at the end of the day, you will see someone you've never raised. Someone with the character that you can't believe is. And that can cause family problems in a way. Next slide. I think we talked about that already. Next. So how can we stay mentally healthy? The previous speaker talked about this, and I really won't talk so much about this, but I want to emphasize that avoid use of alcohol or substances to cope. Once you have a problem, let's be in the habit of sharing. Once you talk about a problem, you start to heal. So sharing is caring. A problem shared is halved. Talk about this problem. Sometimes if you keep quiet, you find yourself taking to alcohol as a means of dealing with your issues or problems that you have. Know your limits, draw realistic targets. I mentioned that we are all different. So learn to say no, and part of self-care is not being selfish. Next. Build your social circles, have friends, have that one person who will look after you. That one person who will notice that your behaviors are changing and will reach out to support you. Have friends, because we all need each other. No man is an island. At the end of the day, you need someone, because at some point you will need help. And they say it's also rewarding to help. So extend help to people if you can, because you get the reward, but you're also building your social cycles and investing in that regard. Next. The others, they talked about this. Make time, practice positive self-talk, and create positive experiences. I think all these were shared. So for the purposes of this, I'll just go to the last slide and say that, no, next slide, the previous one. So on top of what I talked about as the services that exist, we also have some basic documents that are really geared towards improving or promoting the mental health of young people and generally mental health as a country. But we are in this together. Like, we are all stakeholders in mental health. Let's popularize it. Let's all become mental health advocates as we go out. Talk about mental health so that we normalize the talk, the way HIV has been normalized, and break the stigma. That it's okay for me to say I'm feeling sad. It's okay for me to say I'm not fine, and someone will support you in that regard. So, but if you have someone who is mentally ill, support them. Because know that these guys have done nothing to get that. We've noted that the causes of mental health, we find ourselves victims of circumstance. There's nothing nobody does. You don't need to do anything. For as long as you have a brain, you're a candidate. So treat these people like you'd want to be treated when you're mentally ill. So let's break the chain. Let's support each other. Thank you so much for listening to me.